I'm Shannon Weber, and we are here at CROI 2014 in Boston, Massachusetts.
Hi, and I'm Deidre Grant. I work with AVAC.
And I'm Mitchell Warren. I'm the director of AVAC.
Thank you guys so much for joining me, because I want to ask you questions for all the good work that you've done in advancing PrEP in this country, but particularly as it relates to women. So Deidre, I'm wondering if you can tell me, what do we know at this point about PrEP for women in the U.S.?
So what we do know, both about women and a range of populations, is that daily Truvada is an effective means for prevention and reducing risk. And we've seen that across a number of studies, and that the key thing that we've seen is adherence is key. So people who are able to take it on a regular basis are reducing their risk incredibly.
And what do we have in terms of recommendations or guidelines here in the U.S.?
So based on that information from a number of studies, the U.S. Food and Drug Administration approved actually daily Truvada as a prevention option almost 2 years ago now. And then there are also a number of guidelines for various populations that the U.S. CDC has pulled together to help physicians who are looking to provide PrEP for women and men information on how to do so safely.
Great. And then there's a lot of good work that's being done to help increase access to information for providers and then access to PrEP, or an expanded prevention toolkit for patients. Can you tell me about that?
Sure. You know, transitioning from these great clinical trials that have such strong evidence to actually having public health impact is the challenge of access. And things have taken longer than we would all like. Of course, with data coming out 4 years ago and guidance 2 years ago, you'd like to think that PrEP is there and people can access it. And we're reminded that innovation goes slowly, more slowly than we would like. What we have right now are a series of demonstration projects in a number of communities and countries around the world, trying to answer the questions that clinical trials didn't answer. Who wants PrEP? Who can get it? How do you get it? How do you keep that high adherence? How do you motivate someone to continue with PrEP? How do you train providers? Clinical trials don't tell us that, so these projects are trying to do that now. The good news is there are a lot of good materials that are available. Gilead, the company that makes the drug, actually developed materials for providers, and there are a range of materials developed by other organizations to teach providers the data about PrEP, how to talk about PrEP, and there's some challenges. It's not just a pill. So often we think of PrEP as this pill every day. And while there is a pill a day in PrEP, it's really a much more comprehensive program that includes HIV testing. But even more than that, am I at risk? Why am I at risk? How can I manage my risk? Is PrEP right for me? And what's the period of time in which I want to be on PrEP? You know, no one thinks PrEP is for everybody, and even for those people for whom PrEP is an important prevention option, it's probably not for long periods of time. But they're often called seasons of PrEP, when you might be at particular periods in your life or in particular relationships. And so there are tools, and I think a couple of important places to turn. One for the personal experience, for both users as well as people with questions about using it. There's a fantastic blog site called myprepexperience.blogspace.com.
But if you just Google My
PrEP Experience, you'll get it.
Yep.
Exactly. And My PrEP Experience is a great place because you find people who have good experiences taking PrEP. They can tell you why they made the choice, how they're managing the initial side effects. You'll also find people talking about how hard it was. Finding a provider, getting insurance to cover it. Insurance companies do cover PrEP, but you have to actually be asking the right kinds of questions. So this My PrEP Experience is a great community online to help navigate all of those things.
So if I have questions, I could go to My PrEP Experience and learn more, but also submit my question. It's become a hub.
It's become a community, and it's both to submit questions, but also to submit experiences. And you know, at the end of the day, this is not about providers. This is not about a pill. This is not really biomedicine. This is about behavior. It's about a man or a woman who's at risk, who thinks they need additional prevention because condoms aren't working for them for whatever reason. This is about sexuality. This is about relationships. And the My PrEP Experience is a great place for that conversation to continue. The other resource is a website called PrEPwatch.org, where you can find all the background information about the data. What does it actually say? Because these are really complex trials. So what did we learn? But you'll also find links to the guidelines in the United States, links to insurance questions, links to how to get it covered. And people, you know, it's not an inexpensive drug, but there are ways to get it covered. Insurance companies are covering it, and for people who don't have insurance, Gilead, the company again, does provide a patient's assistance program where they will provide the drug to certain people depending on your income level. But all of that information is at PrEPwatch.org. The important thing about PrEP, the most important thing, is it's a new intervention, and we have many more powerful prevention method if we as a community, as providers, as individuals, actually get informed and make good decisions for women and for men.
Great. Thank you both so much.
Thanks.
Great. Thank you.